everyone. Welcome to our celebration of 10 years of Sleep Health, the Journal of the National Sleep Foundation. I'm going to share my screen and I'll walk you through what we're going to be doing today. It's really a great opportunity to share with you. I'm sure a lot of you have seen this image before because this is the original cover of the very first issue of March 2015. And I bet you never really thought about what's the backstory on this journal. So we're going to take you on the story, its origin story, the journey that we're on now, and then what's up ahead in the next hour. We will do about 20 minutes each. I'll start with some early reflections while I'm still wistful. Orfeu's going to tell you what it's like to be in the thick of it, which he is right now. And then we'll end with the incoming editor-in-chief, Dr. Susan Redline, talking about Sleep Health version 3.0, aptly named more relevant than ever. So here's a little bit about the backstory. It was fall 2013, I was a new member of the board of directors of the National Sleep Foundation, and we were, focusing on how the National Sleep Foundation could continue to support its mission of sleep as a public health issue. Things were being reframed from focusing on sleep disorders and sleep deficiency to a more positive spin on the benefits of sleep. But from a very practical standpoint, I shared and some others shared that it was hard to get journals interested in public health research on sleep. A lot of the journals focused on clinical work or basic science, and my work as a public health professor wasn't so easy to get published. And it wasn't just the sleep journals, also the public health journals weren't loving the types of things I was doing. So somebody came up with the great idea, let's start a task force. Amy Wolfson was our trustee chair. I don't know if she's on this call, but I want her to hear about it. Matt Millott, who's still involved with the foundation, and John Lopos, who many of you know, is the executive director of the foundation now. And I was on the board too. We also had one external consultant. So it was mostly board members and this one external consultant. We did surveys, we did focus groups, and what do you know, we came up with the idea of, hey, the landscape needs a sleep as a public health journal. And that was kind of a big risk. But at the time, the executive director, David Cloud, said, I have experience with this, let's do it. And, we came up with the name of a journal. I really wanted it to be Sleep Health and Society, but I have the emails where, basically we were told, no, shorter is better. There was debate over whether we did open access or not. And one of the goals of the journal was to make it very interdisciplinary. And I was trained as a social scientist. I was like, we can't do a journal that requires payment if we want to have social scientists publishing in it, because they don't have the funds to do that. So here are some of the goals, the vision at least. We wanted innovative, high quality, and interdisciplinary sleep health research. So that sounds pretty broad, but the whole thing was linking sleep to the messiness of society. We weren't looking at sleep in a laboratory environment. We wanted to relate it to the real world. We wanted a diverse community. We wanted public health, social science, policy research, and we also wanted to keep a positive spin on sleep health. We didn't want it to be about disease. So that was our vision. And then we went in and started defining scope, the epidemiology of sleep, also relatedly, the social and behavioral determinants of sleep, consequences on health, well-being, academic outcomes, economic outcomes, and what we thought was very novel and also hard to get publications on was policy relevant intervention research across a range of domains: education, transportation, healthcare. We didn't want those going to other journals. We wanted them, or other disciplinary journals. We wanted them to come to us. And that was really important. We also did not want to compete with the existing top journals, at least for some of the things. We wanted to clearly have a differentiation. We were not publishing on patient populations. We were not doing basic sleep research. There was a little resistance in the beginning. JCSM had an editorial saying there are enough sleep journals already. Who's going to review all of these? And that sort of set my fire a little bit. I was like, okay, we got to prove them wrong, because there is space for this. And in my opinion, we have definitely succeeded. I didn't mention, but I will say, there was an interview process. I was on the committee that decided to do the journal, and then I did apply and did get the job, but it's still unclear to me if anybody else applied. But there was that process, how I got to be here from the very beginning. So, as I mentioned, the very first issue was March 2015. And that meant that all of the articles had to be submitted by December 1 of 2014. I think I accepted the position in early October, and things were moving fast. On top of that, as you can see from this picture, I was 9 months pregnant. So I was pregnant, I was in the hospital, making calls, finding an editorial board, all of these things. This article was published about the journal and about my work on sleep disparities on October 28th, 2014. I included the date because that's actually the birth date of my second son, Augie. And there are a lot of parallels. I was giving birth to a child, and I was also giving birth to this journal. And both things taught me how parenting and studying sleep in the real world taught me how messy things are. You need to get in the weeds, get in the real world, get in the environment to understand the trade-offs that happen with both kids and healthy sleep. And that it relates to why I think sleep health as a journal is so important. There's room for the experimental science on sleep, and there's also needs to be a translation to understanding the impact of sleep in the real world. So here's my way I remember how old sleep is. This was when I started. Augie was an infant. Orfeu came in during the elementary school years, and I want to welcome Susan to the tween-age years of the journal. Good luck. I think it's going to get harder because definitely things are growing. But we started with a pretty amazing editorial board. It's a little hard to read, but there were a bunch of incredible scholars who stood by me and took this leap of faith with the journal with no impact factor, no indexing. And I said, we can do this. And international, some people I'd never met. The way I recruited these people was, some version of coercion and enthusiasm. And kind of most importantly, I just said, there's a demand for this. We need to do this. So come with me on this journey. This is the very first issue's masthead. You'll notice Mayor Krieger was there. We didn't yet have an ombudsman, but we did eventually. And then also, it wasn't until the next issue or two that we got some associate editors, thank God. Orfeu, Michael Grenner, and Amy Wolfson joined in the first year. The second year, we added Wendy Troxel, Rue Gruber, and Eric Prather. I wish I had gorgeous pictures of all of them, but I didn't do that. And then finally, in the fourth year, we were growing so much. I added Julio Fernandez Mendoza, Kelly Barron, and Matthias Basner. What an awesome team. Almost all of these people are still very actively involved in the journal, and I'm so appreciative. Some quick highlights. I think, to me, my favorite part of the journal is just how beautiful it is. Mayor Krieger's work as the art editorialist is truly singular. I think it makes the journal stand out in so many ways. I've had the pleasure of getting to know him. One time he came and gave a lecture at Stony Brook, where I am. He took the ferry across on sleep in art, and then we had lunch. He's incredible. I loved in our first issue, we had we've had many outstanding editorials, but we had one from Chuck Seisler and one from Mark Rosekind on sleep health broadly and also public safety. At the time, Rosekind was the administrator for NTSB. I remember we were on this tight timeline. I was like having a brand new baby and Mark's article wasn't coming in. I was so anxious. Were we going to be late? What's going to happen? And I somehow got him on the phone and he told me, he said, I got the article written, but I can't send it to you till I get the boss's approval. And I was like, well, who's your boss? And he said, President Obama. And then I realized the magnitude of what we were doing. And I just think about now, like what it would be like if we needed the president's approval for anything we were publishing. But how lucky we were that we started the journal when we did. The second really wonderful memory, the third point I want to make is the NSF has a really valuable service that they provide consensus panels on topics related to sleep health, whether it's quality, duration, screens, huge range of satisfaction. And we've been publishing the consensus panels in sleep health. It was not only it's a useful service, but it's hugely strategic for the journal because we get tons of citations from those consensus panels, and that's one of our strengths. And then my other favorite thing is that we do these special issues. So here's my first special issue. Karen Bonek edited a volume on, or an issue on sleep in early life. And Javier Nieto, separately told me he wanted to choose a cover art one time. So I said, oh, sure, we have a issue coming up about sleep in early life. So here, you can choose this piece of art by Soroya and put it on the cover. And he wrote an issue. He wrote a little editorial. It was, I thought, beautiful. And then, sure enough, within 1 week of the journal being published, I started to get letters to the editor. How dare you, a journal on sleep health, publish a picture on the cover of a baby co-sleeping in a bed covered with cushions and pillows. It's such unsafe conditions. And I was only 1 year into being an editor. I was so concerned about doing something risky and upsetting people. I didn't know what to do. I was at the time collaborating with Paul Papard, who was at Wisconsin with Javier at the time. And I said, what should I do? Should I make Javier write a response, or what should I do? And my favorite thing, Paul Papard is so funny. He wrote back to me. He said, also not recommended, pointing me to the prior issue in which we have a lion hovering over a sleeping woman. So I think for me, that was my lesson when I was like, oh, wait, the editor doesn't have to please everyone. It's okay to have something out there that doesn't, it's a room for conversation. It's not the editor's job to make everybody happy. In 2016, our journal was recognized, the Association of Publishers. We won the Prose Award for Best New Journal, which was pretty awesome and a surprise. Didn't see that coming, but was thrilled to get the recognition. I did check out how the American Journal of Health Economics, which came in honorable mention that year, is doing. And by the way, Orfeu, well done. We're still beating it in terms of impact factor. So nicely done. But anyway, this was incredible to be recognized as we were. And then I have just a summary slide. I think Orfeu is going to find this funny because these numbers are so low to the numbers that he sees now. But these were our submission rates in the first 4 years. I didn't have 220 through to the end, but 84 in the first year, or I guess that was the second year, 189, 223, 306. Rejection rates around 50%, and it's gone up since then. You can also just see the high percentage of desk rejects. I don't know how that compares now, but really we have come a long way, and I am so proud of our journal. I love our covers. As I said, if you were on the editorial board in 2018, we made this door swag, which still decorates my office door. And this is my final shot, some of the key players in the early days of sleep health. So I think that's all I have to share, but maybe there's room for questions a little bit later. So Orfeu, perfect. That's great.
Okay. So back to 2019. Everything was great. We were in transition. Lauren, you had the new band shirt, getting the band back together for sleep health presentations at a sleep meeting. Amber was in a world at peace and sleeping joyfully, and we were at 300 submissions and growing at a 25% a year rate in terms of submissions. Hello, everyone. I'm Orfeu Buxton, editor-in-chief of Sleep Health, and Elizabeth Fenton Susman, professor of biobehavioral health, and I do research at Penn State. In 2020, this was the masthead. What you'll mostly see is that the fonts get smaller and smaller as we continue to grow. These were just the associate editors at that point. I believe it's 21 in 2020, trying to keep up with the pace of submissions. The editorial board was also expanded substantially to expand our global presence, as well as increase expertise and bring in new people and develop a crew that could continue on into the future. So this journal isn't about any one person or any one editor. A goal was really a community, sustaining and growing a community of sleep health readers, authors, and editors that could work together to bring these new approaches to sleep health into the published realm. Key partner in crime was Amanda Applegate, our amazing journal assistant the last 5 years. That was some cover art in 2020. But of course, there was the pandemic. So here's a favorite meme from the time: good night moon, good night Zoom, good night sense of impending doom. The little rabbit says to the mouse in the middle of the rug. And so that's sort of changed everything. Suddenly, everybody's remote, and it's incredibly stressful. Despite that, we were able to get out several critical special issues. Sleep and Work, Bidirectional Effects of Sleep and Work with Steve Shea had begun pre-pandemic. Doug Tatey also proposed and led a group of guest editors on a sleep in the family system special issue, increasing the number of associate editors with pediatric experience, greatly increasing our pediatric sleep portfolio. And they also conducted a webinar of some select papers on that, which is something we continue to do. In 2024, we also published an extra 7th issue of Festschrift for Dr. Charles Seisler, led by those editors there. All these are available at sleephealthjournal.org as issues or as articles within those issues. Through the pandemic, we really had many challenges. Excellent, a great impact factor that we were very happy with. Continued pandemic impacts, though, created more challenges. It became incredibly hard to get people to review, and even if people would review, they could just disappear. Oh, they got sick, or a family member got sick, or there was some other pandemic-related chaos that occurred. And so it really was a challenge. We had doubled to 650 by that point. And associate editors in midlife generally were faced with many of these things. It could be issues with their children getting to school. It could be problems with their grants creating for being unable to be in person, or elder care and parents and other family members getting ill. And so associate editors were unavailable, about a quarter to a third of them at any one time, often unexpected and often for months. So these challenges made it more difficult, but we continue to sustain and grow our community, again, remotely, with even scientific meetings canceled. Then there was the war in Ukraine, and we picked a piece of cover art. This woman is napping, apparently daytime, and you can see her phone, or their phone, is down where they've dropped it, and they're in a dream, apparently, possibly a nightmare. And we chose this art because it was on this ARC Gallery website, and they had a statement: we are against any manifestation of violence and aggression, and we believe that war does not help to reconcile any differences, but creates new, irresolvable ones. So with the war in Ukraine and later conflicts, we continue to see increasing chaos around the world and for our author and reviewer and editor communities. In addition to the special issues in print, we also have virtual special issues that serve as outreach and we find very important. One of those is hashtag No Justice, No Sleep, Critical Intersections of race, ethnicity, income, education, and social determinants in sleep health disparities. There's a fantastic comment written by Royette Dubar, who oversaw that issue. There was an update on school start times and adolescent sleep that Lauren and Wendy Troxel wrote. This was led by the California Sleep Summit that preceded the change in state policy regarding school start times, a true achievement of sleep health in terms of public policy impact. Max de Zambati proposed, and we wrote a rigorous performance evaluations standards for evaluations of devices and algorithms. And then with those submitted manuscripts that were published, he also created a virtual special issue. We find that as leadership in the field, showing standards and then following through on those with peer review. This made it much easier to write, submit, review, and make decisions about these performance evaluations because there are standards that people could keep to rather than arguing about all the historical different ways to do that. I wanted to highlight another article from 2024, which was Diversity, Equity, and Inclusion Findings from the Sleep Research Society. This paper was not considered in Sleep or Sleep Advances, even though it was about the Sleep Research Society. And you can see the number of authors there represent many experts on DEI topics in the field. And we thought that this paper was very important to get out, and contributing to the expertise of that group was the expertise of the reviewers and editors, which the authors and I and others would agree greatly improved the presentation and interpretation of those data and what they mean for the field. Though it wasn't accepted in Sleep or Sleep Advances for review editorially, it also became a featured paper for sleep health, and the Sleep Research Society cross-promoted it with us. So this is the type of community that sleep health aspires to in the past and going forward. We also had a paper called A Call for Civility and Peer Review. This is one of our most impactful editorials, a short communication. This was work started by Ariel Williamson and I, and also with tremendous contributions from Senior Statistical Associate Editor Meredith Wallace and our journal assistant Amanda Applegate. The idea was to provide suggestions for how to give a positive criticism that's generative. So this quote from Frank Clark leads the paper: "Criticism, like rain, should be gentle enough to nourish a person's growth without destroying their roots." And we provide specific ways that we aspire to that in our peer review process and editorial processes. And we think that this civility in the social fabric of peer review is essential, especially as there are challenges going forward to the quality of peer review and peer review as a business. We hope that it provides meaningful engagement with authors, that it reduces burnout of authors and reviewers and editors just to get over nasty and dragging comments and moving to productively moving forward as a field. We feel that this is another sign of or marker of leadership in the field from the sleep health editorial team. And what have we been up to? Well, in 2024, we had over 1,000 manuscripts, and in 2025, we're projecting close to 1,200 at the current rate. This is sustained growth of about 25% per year. I'd love it if my 401k behaved as kindly, but this means that the structures in sleep health really are about sustaining productivity, quality, civility, and our community at an incredible pace over time. Accept and reject decision rates are shown on the right. We have a very high desk reject rate and also a rejection rate. The quality of our papers have continued to go up and up as they have across the field. And we feel very proud of all papers published in sleep health. There are many worthy papers that are not accepted in sleep health. This has been possible not only with the many associate directors, but now a journal leadership team that includes senior associate editors Kelly Barron and Matthias Basner, who have been with us for some time, and Meredith Wallace, Senior Associate Statistical Editor, started several years ago. And this really would not be possible without them. They oversee many manuscripts independently, and any on which I would be in conflict. And one of us makes final decisions on all papers. The sleep health editors as of February have increased. I believe we're at 31 total, including the senior associate editors. The fonts just keep getting smaller and smaller. I'm indebted to each of these incredibly valuable associate editors, and for their civility, for their expertise, and for their good judgment and a generative positivity. The Sleep Health Editorial Board has stayed roughly the same in terms of size. We've continued to expand as some people have rolled off over time. And our priorities are largely unchanged, except life has gotten a lot more complicated. So we continue to aspire to a global, multidisciplinary, and interdisciplinary perspective. We have a continued urgent need to prioritize vulnerable populations, especially given the current climate, and we're not shying away from that. We continue to strive to maintain our relationships, the social fabric of our community, with associate editors, editorial board members, reviewers, authors, despite all of these challenges to our fundamentals. And we increase or maintain our review speed despite the ever-increasing difficulty finding reviewers. That's across all journals. Other headwinds include sustaining legitimacy of the journal at all as a peer-reviewed scientific publication, given increasing delistings of journals for fraud in the peer review process, the increasing imposition of AI on all levels of processes, increasing numbers of retractions, and so on. So the systems that we have to put in place to deal with all of those things at scale are no small challenge. And we're working closely with Dr. Redline to help that come to be. How are we facing these challenges in the current climate? Well, this is our April 2025 issue, just a few highlights of the 20 plus, 25-ish articles. The cover art is a collage of many favorites from the past. The highlights include how deportation entanglement influences U.S. Latino adult health in a longitudinal study. Just engaging with the deportation apparatus negatively influences sleep health. Evaluating barriers and facilitators in a qualitative mixed method study to sleep health among American Indian peoples. A longitudinal study of adolescent females in Uganda. How gender differences and associations between work factors and insomnia affect Korean workers, and a latest report from the National Sleep Foundation on drowsy driving prevalence and beliefs among a nationally representative U.S. sample, describing the rationale for why drowsy driving interventions are more, and public policy change are more important than ever. And finally, our special issue upcoming for August 2025 is on sleep deserts, how environments and sleep interact, led by Dana Johnson, with support from Kristen Knudsen, Lauren Hale, and Harara Tarian. This will be not only a special issue for August, but is a webinar slated for September. So thank you for your attention. Happy to take questions. But first, Dr. Susan Redline, incoming editor-in-chief.
Okay, well, thank you very much. It's really just an honor to be here today. And I must tell you, following Dr. Hale's and Dr. Buxton's footsteps gives me great excitement, but really a fair bit of trepidation. And it's, however, it's nonetheless my joy today to be sharing with you some of my ideas as we together will navigate these tumultuous times and step up to the opportunities that sleep health provides all of us. So I'm hoping that this is the first of many conversations we will have together. As you heard from the prior two talks, in a mere 10 years, Dr. Hale and Dr. Buxton have planted the seeds, nurtured the plants, and really given rise to a journal that places truly a unique niche in the academic landscape. And as Dr. Hale so nicely described, really fitting that niche between sleep, society, and public health. Now, as the incoming editor, I'm very much looking forward to embracing that mission. And I'm particularly excited given my own passion for sleep health and knowing that sleep health over the years in my career, I've seen it be accepted as a cornerstone of general health and well-being. Nonetheless, I'm also very aware that most of the population still experiences inadequate sleep, and inadequate sleep disproportionately burdens socially disadvantaged groups. I'm very much committed to the idea that as a community, we need to better engage our public health and policymakers in systematic efforts to develop, implement, and monitor strategies for improving sleep health at a population level. Therefore, as a journal, and the journal Sleep Health in particular has a role in encouraging the generation and directly disseminating the evidence that, number one, improves our understanding of multi-level risk factors for sleep health across the lifespan in special populations, the role of sleep in promoting health and well-being, identifies effective community level interventions and their application, for example, with implementation science, leverages new opportunities afforded by big data and machine learning to meet those goals, and identifies the smart use of sleep technology in the population. I'm also, as been hinted, very acutely aware of the many special challenges we are facing in this world, even from the time I applied to be the editor and the reality we're now dealing with. Our world has turned upside down. And amongst the challenges, one of them that's been coming for a bit of a while is the whole challenges to academic publishing, as in fact, the publishing model moves away from paper into electronic media, as technology tools may actually exacerbate issues related to plagiarism and veracity of the work we publish. And then finally, even the challenges the community faces as academic publishers and the academic community really seek to establish a business model to ensure the adequate sort of resourcing of what we do as authors, editors, and reviewers. In addition, and this is, of course, the Dr. Buxton referred to, is we are in a uniquely challenging time, that is, as scientists, as scholars, as educators, given our own personal threats and our community's threats to funding and academic support. In fact, although academics have always faced challenges, it's clear that the bedrock that we usually rely on is very much under attack. And in particular, some of the goals for our journal and our own passion of seeking equity in health through sleep and promoting adequate sleep for all populations is also at risk. And finally, we know that there's been a plethora of miscommunications and misinformation in our community. And as really the guardians or some of the individuals who really disseminate information, we really have to commit to overcoming that mistrust by further doubling down on transparency, communication, and really ensuring we publish the highest and the most rigorous evidence. These particular challenges are widely sort of discussed among editorial communities, and I was recently had that opportunity to endorse an article that's in press at the British Journal of Psychology. And this was an article entitled, or statement, "Truthful Communication of Mental Sciences, a Pledge to Our Patients and Professions," and wanted to share with you three of the key take-home messages that editors around the world signed on to, including myself. And that was, number one, to communicate research that has been conducted ethically and report findings that are scientifically accurate and clinically meaningful. Two, to publish science that reflects reality and advances knowledge based on inclusion of those who are disadvantaged. And finally, to uphold our high standards of scientific publishing and maintaining the integrity of our research record. So specifically, as I attempt to wade these waters and keep the momentum that my predecessors have started, here are some of my priorities. Number one, I see the journal as supporting the academic discourse that enriches our community and attracts new scientists to our field and really supports our community of sleep health scholars. Number two, a journal that stimulates the generation of new knowledge. What we publish generates new ideas and gives hope to publishing those ideas, and particular in areas related to sleep health across the population. Third, that we disseminate the knowledge to all communities and we speak beyond, even those in our own rooms and our own towers. And finally, that what we do really advances and informs health behaviors, healthcare system delivery models, and social and health policies. So very specifically in Sleep Health version 3.0, I will work, and I've begun to do this with Orfeu's tremendous patience and guidance, to put forth a plan to further crystallize and publicize the unique identity of sleep health. My second goal, again, is to disseminate high-impact articles as well as reviews to diverse audiences and really to expand some of the dissemination channels currently at use. We want to, of course, continue to attract and publish the very highest quality articles consistent with our mission. And finally, Dr. Buxton's done an amazing job with his approach to nurturing his editorial board. And I'm also committed to that goal, as well as to really ensuring that our editorial board works in a learning environment, which makes each and every one of our efforts exciting, effective, and makes us better editors as well as better scientists by working together. One of the things that I've been doing a fair bit of contemplation of is thinking of what really, given the unique niche that Dr. Hale really outlined for the journal, how we might break this into maybe a hierarchy or an organizational tree of topics so we understand really where the sweet spot is for the types of articles we want to publish. And this is a work in progress. I will continue to look forward to working with editors and authors and others to refine this approach. But just to share them with you, I see what we publish, including information on both individual and community level risk factors and moderators for sleep health that really includes multiple levels, from social to behavioral to the physical environment, and utilizes really multi-level, multi-exposure or exposome approaches. Continue to endorse the interest in understanding sleep in specific settings like the family or jobs and schools, and sleep across the entire lifespan and in special understudied populations. understand how institutional practices, whether they be schools or workplace and others, influence sleep health and sleep as a driver for health outcomes in terms of chronic disease risk, safety, and injury prevention. And then going to interventions, this has been an area that I think the journals continue to refine its specific niche. And I see our interest in interventions being those that really help us understand how to translate sleep health interventions into the community, including research on how to do that, which is also known as implementation science. Interventions that include community-based interventions, health communications, interventions adapted to special populations, as well as certain health services research. And clearly our journal is committed to publishing relevant articles that influences public policy, including guidelines, statistical trends, and work by the National Sleep Foundation itself. And then finally, information related to population-based tools, measurements, and messaging related to sleep health include technology, big data, and educational initiatives. One area that I like to develop is to take those various larger profile topics that I review and begin to use them to not only identify or tag the articles that we publish, but also have those topics really inform additional communication vehicles, which might include the webinars and editorials and special editions, but even more so inform an aggressive dissemination strategy where for each, for our various sets of articles that we publish, we ask as we publish them, who are the key stakeholders? Who are the people who need to know this information outside of the typical four walls that we speak to, and attempt to get that information into the hands of those individuals. And I like to, and this was an idea of one of our new incoming AEs, is to use really scientific tools, including our own, maybe systematic reviews of what we publish to really begin to understand the strengths and gaps in what we're publishing. So just to go into a little deeper in each of these, I'll now review a little bit of some of the dissemination plans. We will continue to work and coordinate closely with the National Sleep Foundation to publish their key papers that address the topics and align with the standards of the journal. And I also, in addition to encouraging editorials and commentary by the usual leaders in our field, I would also encourage commentaries by people outside of our field who particularly may be able to provide unique perspectives over what we are writing and what we are doing and how our work can be integrated more, generally. I see roles for us to highlight our work, not only, at multiple national and international meetings, perhaps in symposia where we invite authors of some of our, very impactful or theme-oriented publications and develop symposia that we lead as representatives of the journals, and likewise coordinate and collaborate with other professional organizations that are like-minded, like the APHA, the AHA, and others. Now, as Dr. Buxton has done an amazing sort of job with growing and nurturing his associate editors. I just am so impressed with everything he's done, and want to try as much as possible to follow again that amazing role model he's really developed in terms of supporting our AEs, and as well as continuing and approaching really our AE family as also an opportunity to encourage mutual learning amongst each other, encourage our AEs to take leadership roles in commentaries and webinars, have our AEs work as closely as possible so there is ongoing calibration and consensus in the approach to decision making on articles, and ensuring that we all stay up to date on the latest standards for publications, for example, statistical methods. We know one of the biggest challenges in working on a journal and being an editor is finding reviewers. Everyone is very overworked, and I noted that things are going to only become harder over time. And I want to work with the community to further understand the best ways to engage reviewers, reward them, acknowledge them. I'm discussing now with a number of folks how we might be able to pilot a reviewer apprentice program or a young investigator editorial board in order to engage young investigators early on in the peer review process, which not only will strengthen their ties to our journal, but also should make them better researchers themselves, because so much of peer review can be used to sharpen your own critical thinking skills. I also recognize that we want to keep an edge in attracting really the best articles. And one of the things we want to do is to try to shorten decision-making and publication lags, and much easier said than done. But I like to be able to really monitor this process, that there's a very long complicated process from when an article is actually uploaded to when it's published, and try to understand any bottlenecks and really and constantly monitor and try to overcome them. And then finally, there's a lot of work that all the associate editors do. Dr. Buxton shared with you the current AEs. In addition to that panel of AEs, given the growing workload as well as the scope of what we are anticipating we're going to see in terms of articles, I've invited 9 new AEs, and I'm just really delighted to welcome them. They represent 5 different countries across multiple disciplines and training programs, and they include, and you can see their names here: Robert Adams from Australia, Kelsey Full, Xiao Yu Li from China, Anna May, Eva Schönhammer from Brussels, Jarvis Chen, Tatiana Kenzerka from Canada, Sushmita Pamidi from Canada, Christopher Jake, and also welcome a new journal assistant, Amber, very aptly named after Orfeu's, one of Orfeu's favorite words, and who's really been stepping up and working very closely with Amanda, and I know she's going to do a fantastic job. So in that note, I'm with great humility, but also excitement and some trepidation. I thank you for this opportunity. I thank the National Sleep Foundation for this opportunity. I thank Lauren and Orfeu for, getting the journal to this point and working with me with this transition. And I look forward to working with everyone together. So thank you.
Thank you. Thank you so much, Susan. It's awesome to hear your vision. So it looks like we have about, and you shouldn't be scared. It's a big endeavor, but I know you have the capacity to do it. I think we have 10 minutes. It looks like the question and answer could work. I think Amanda just wrote something in. I'd love to open it up for questions. Susan, you can take your audio off mute, and we'll just do a free-for-all and responding a little bit of fireside chat this April morning or afternoon. Does anybody have things they would like to ask, comment, or we could go into a directed conversation suggested by Orfeu of let's talk about how we can make the peer review process better. Because Susan highlighted that's always been the challenge, but it's only gotten harder since I started. First of all, when I started, there are many fewer articles, but the pandemic and all of the other constraints have complicated this. So let's see what's happening in the chat here.
So I wanted to just offer, does anyone have comments or suggestions for improving satisfaction with peer review?
Okay.
It's a service. It can be important for a tenure packet, but it's also very difficult to fit in. It's important for long-term intellectual development and rigor. But what would motivate you to do more for sleep health or for peer review generally? As mentioned by Susan, I favor mentored peer reviews and support those. I think it's very helpful to bring along postdocs and graduate students in a gentle way that allows them to provide some initial feedback, discuss that feedback, refine that feedback, and then negotiate the territory between confidential comments to editor that might be more blunt, and then generative, civil, and constructive, more helpful comments to authors. So does anyone have suggestions for improving that process?
So, the two, sort of two approaches for engaging maybe more junior folks in that peer review process would actually be able to, have, I think, several of our AEs volunteer to be mentors, and then really build a curriculum where we go through, that whole peer review evaluation and peer review approaches, how to judge an article's quality and how to also provide feedback. And I remember many years ago that when I was working in my MPH at School of Public Health, I had a whole course where in fact every week we critiqued an article in the content area, and just by critiquing the article we learned the content. It was actually an environmental health class, but that's how we learned things. And that critique process, I think, really it can be, it could really sharpen your scientific thinking. And I'm thinking maybe a lot of young people will benefit from that while being engaged in the journal, but I don't know how others feel about that.
We have one volunteer for the program you just mentioned. Thank you, Susan.
Great.
And Amanda is thanking us for building this community, but Amanda Applegate was a big part of also building and supporting that community for all those years too. So thanks to you also, Amanda. Amber suggests a checklist to be helpful for those new to the reviewing process. We do have some Elsevier materials available on the website, and then we also have guidance to reviewers, I believe, on the website as well, or at least come with the review request, but we could always improve those and make those more accessible. I do like a checklist format. That's a good idea.
I think anything to make the process as smooth and less time consuming, the least time consuming, but high impact. And one of that really involves making sure that there's the desk rejects are thoughtful, that articles don't get sent out for review that don't meet the minimum standards, and that just to reduce the flow, because we don't want to ask people to review things if it's not going to be within scope or to the standards. I know that's pre-getting to the reviewers, but that's a key step, and requires coordination and rules to make it fair.
Yeah, not every paper that's reviewed will be accepted, but if it goes for review, it has a much higher chance of meeting standards. So that's the desk reject process. That's somewhere between 70 and 80% of incoming manuscripts are desk rejected at an initial editorial level by either one or a couple of editors in conversation. Cassandra mentions some interesting points in the chat to everyone. So I'm also realizing that while we allow mentored reviews, they're perhaps not well publicized. So the current process is for a senior person to accept the review, to let the editors know that mentored peer review will happen or happened in the past in the comments to editor, and then that the senior author takes full responsibility for the review. So that ensures the protection of the authors and the editors. Then as that person becomes, the trainee becomes, qualified and demonstrated capacity at that, then the senior author can note that they should be mentioned as a reviewer and ready to receive direct review requests. So that's the current process that we're using, and perhaps, Susan, you'll want to update that to be more systematic and maybe embedded in the EM system. So Lauren, as you heard what Susan and I said, were there any things that surprised you or just, come across as completely unimaginable from the first 5-year perspective?
I mean, gosh, that's a nice way to broaden it. The biggest change, obviously, is, or to me, is the role of AI in the conversation about how to handle it, and the mistrust in science. I think those were not on the table. We were concerned about plagiarism, but that was detectable. The change in the capacity of AI to do the generative writing, and also the idea that people might not trust what is being published. It just I never would have seen that coming. Now I've internalized it, but it's really quite a change from 10 years ago. Ooh, we got a question. Oh.
Yeah, Susan, do you want to address Roya Dubar's suggestion?
Yeah,
We
no, so
responded back.
so the chat was in fact to again formalize the peer review process, perhaps with some webinars. And I think that's a fantastic idea. I think there is so much, I have to just say, as part of Orfeo's onboarding me, I have learned so much from him on, how he applies a critical lens to prioritize what gets published, and in ways that I had not thought about before. So I really thank Orfeo for that. And I think the extent to which the journal can, encourage those best practices, as well as do so in a way such that the approaches are consistent across people, will one, there'll be more of a curriculum for us to understand, but will lead to greater consistency in our decision making. So Dr. Dubar, thank you for that. And I'm trying to think of best ways to engage people in something more formal. And they may be, amongst the other issues is even getting together, annually or biannually, at meetings, and really having mini workshops as well.
I think we're at time, but for me, this was a really lovely trip down memory lane. I have the advantage of just looking back, but thank you, Orfeo, for everything you have done up until now to get us through these very challenging 5 years. And good luck, Susan, on the road ahead. You don't need,
I'll need it.
you don't need it, but it will be bumpy. So.
And thank you, Lauren, for really planting those seeds and nurturing them, as Orfeo said. That I should have connected your quote, Orfeo, to the seedlings. And thank you all. We appreciate your attendance today and look forward to working with you.
Thanks, everyone.
Bye.
Sleep well.